Okay. Thank you so much, everyone, for joining us today. If we have our technology sorted out, we should be live on YouTube for you, as well as accessible via the Zoom link on the website and a telephone number that's provided on the registration link. There is captioning on the YouTube, as well as the option on Zoom to turn on your captioning. I'm normally here as technical support, but my fellow moderator cannot join me today, so I will be moderating, and I'm going to introduce myself, but I also want to encourage our panelists today to have more of a discussion format. Since it is just me, I would like to hear from you, and if you have any follow-up to each other, I would love to hear and encourage that conversation. My name is Sara Ann Joehnk, and I am the Disability Integration Specialist at the Arizona Statewide Independent Living Council. And this year has been very different, as you can imagine, with COVID-19. We have a regular Partners in Preparedness Summit that used to be a 1 or 2 day in-person conference. And to adapt to the new situation, we made it a national, not just statewide, webinar. It's a web series all summer long. So we started out with a large web conference introducing our subject, which is disability justice, and following up with weekly webinars, which will conclude in September with an event with COPA Health. So I'm excited that one of our panelists is from COPA Health as well. So I want to do a little bit of introductions to our panelists, but then I am going to open it up with a question that will allow them to kind of continue introducing themselves for you. And I normally have my little script on a piece of paper, but it's old technology today, so let me do that on my cell phone now. There we go. Dr. Clarice Kripke is a clinical professor of the Family and Community Medicine at University of California. She directs the Office of Developmental Primary Care, a program dedicated to improving outcomes for people with developmental disabilities across the lifespan, with an emphasis on adolescents and adults. Norm Duvet is the Chief Developmental Officer at COPA Health. COPA Health is a private, nonprofit corporation providing education, therapeutic, rehabilitation, and social services to children and adults with developmental and physical disabilities and behavioral health challenges. Shamika Andrews is the Community Outreach Coordinator of Self-Advocacy Association of NYS. This is a nonprofit grassroots organization run by and for people with developmental disabilities, with the goal of helping to create a person-centered and person-directed system of supports. And so with that, I want to ask each panelist individually the first question, which is going to be the same one. Could you tell us a bit about yourself and how your work has changed as a result of the COVID-19 pandemic? And so I would like to first turn that over to Shamika. So Shamika, can you tell us a little more about you? Oh, and I don't hear you. That might be me. I have an extra button I have to hit. There you go.
Okay. Sorry about that. So I have been with the Self-Advocacy Association for the past 20 years in a variety of roles. I started out in their AmeriCorps project doing disability awareness in schools. Then I went on to do regional organizing, just here in the capital, focused here in the capital region. And now for the last 2 years, I've been the community outreach coordinator, focusing on doing outreach statewide, focusing on providing information on our website and through our social media platforms as well, and just connecting with organizations and individuals that we provide resources to. When I'm not working at Self-Advocacy, I am a part of a variety of other community organizations as a volunteer. I am the state coordinator of the Miss Wheelchair New York program. I also sit on various disability services boards as well. So that's a little bit about me.
And how has things changed with COVID-19?
Well, I think since since COVID, like many people, we are doing lots of things online and on Zoom, just like this. SAMES is a statewide organization. So we have 6 regions. So all of our regional meetings are all on Zoom. We have weekly, if you follow us on Facebook or online, you'll see that we host weekly events to be able to connect individuals with disabilities and help them get resources during this time, to connect to each other, to connect to the services that they need, and to make sure that with all of the things with COVID going on, that people with disabilities are not left behind, and still are able to get the services they need as much as we can, do that.
Thank you so much. And I want to turn it over to you, Dr. Clarissa. Could you tell us a little bit about the work you do normally, and then how that's changed with COVID-19?
I don't know if you're in our feed here.
Yes, so I'm Dr. Clarissa Kripke, and I am the director of the Office of Developmental Primary Care. And like you mentioned, the goal of our program is to build the capacity of the healthcare system to serve transition age youth and adults with developmental disabilities. And I'm the primary care doctor for about 100 people with developmental disabilities who are very medically fragile and behaviorally complex. And I do home visits to and provide care to people in their homes. And so this has been a very active time for us, both in doing a lot of training and prevention work and outreach in programs like this, to make sure that people understand the medical information that's been so confusing. It's been changing very rapidly. There's a lot of misinformation coming from places that we would normally trust, like government leaders and the media, and places where we can usually get reliable information, and there's unreliable information coming out of those places. So it's been very challenging for people to understand how to keep themselves safe, how to keep their loved ones safe, and how to make sure that we still participate fully in our communities, no matter what's going on, and that we have the same resources and the same access that everybody else does. So some of the things that are different for me is like Shamika said, I'm spending a lot of time doing my visits to patients through telehealth, working with nurses on site, and doing meetings like this online. I've been spending a lot of time on trying to put things in place so that we can prevent people with developmental disabilities who are at very high risk of having complications from COVID-19, from getting sick or getting exposed to this virus. This virus is not safe. It is, and people with developmental disabilities are definitely at higher risk of needing to go to the hospital or of dying from the virus. So we need to be very, very careful to help people with developmental disabilities to stay safe. And then if we do have a case, making sure that we don't spread it, that we can contain it, that we can keep it from going to other people in the household, other people with disabilities, other people who might be vulnerable, and the staff who serve us. And then if people do get sick, how do we provide the best care possible so that they recover from the virus? And so I've been working on all those things, but the most important thing is prevention, because the other things are still very difficult. I'll leave it at that. We can talk more about other things later.
Absolutely. We want to get into those issues. Thank you. And now I want to turn it over to Norm. Please take a moment to say a little bit about what you do and how it's changed now with COVID-19. Oh, and I have to ask to unmute. There you go.
So, hi everybody. Thank you for having me today, Sara Ann. And I'm actually the Chief Development Officer here at COPA Health, and we are an organization that started in 1957 with 9 families who had children with intellectual and developmental disabilities, and they just couldn't find services. And since that time, we have grown to be a fairly large organization. We serve, roughly 2,000 people with intellectual and developmental disabilities, and thousands and thousands more with behavioral health issues. And my path to becoming a Chief Development Officer, I used to work in supported employment back in the 80s and 90s. Spent a short 5-6 years working for a technology company, and I realized what technology could do to make the lives of the people that we serve better. So I came back to the nonprofit world and have been with COPA now for coming up on 19 years. And my goal is safety and making sure that the people that we serve are safe and have access. Sara Ann's familiar with a lot of the work that we've done, but we've had emergency preparedness and safety conferences now coming up. I think this is going to be our 7th annual year. And last year, and I hate to think that we were like Nostradamus and we predicted this, but last year's ours focused on planning for a pandemic, and it hit on so many of the things we're dealing with right now. We serve people in an employment-related capacity. We have the largest employment-related services in the state for people with intellectual and developmental disabilities. We have group homes, we have in-home supports, in-home services, and our day programs. And I think right now the most important thing is not just the safety, because that's always paramount. It's been paramount for everything that we do, but making sure that the level of connection that these individuals that we serve doesn't fall off socially, because we worry so much that they are going to become depressed or lose some of the skills that they have because they're no longer meeting on a daily basis. We have a partial up, our employment-related services partially up and running using social distancing, and we've done a good job keeping the folks safe doing that. But so many of the people that work out in the community, they just can't be working on the community anymore. So we're trying to find alternatives using technology to engage with them.
Thank you. And then just for the next part of our conversation, I want to consider that our audience today kind of has 3 different groups. We have joining us professionals who are emergency managers. They're mostly people who registered and are on the Zoom with us. We have people who are disability advocates and working at organizations. And then we also have people who are members of the public, and so wouldn't call themselves an advocate yet, but they have family members and are watching this on the YouTube. So I just kind of wanted to keep that in mind with our conversation. And so many of our issues, we might see something on the news that's concerning, but it's like it's one story, that's one family, but then we as professionals have to take that to the next level. So then we have to take it and what happens for policies in any kind of group homes or those settings, what happens for policy on a statewide level. And so with the first question is honestly something I personally had thought of because we saw it in Texas. And it was that the case, a gentleman named Michael, I believe he had a traumatic brain injury and not necessarily a developmental disability, but what happened was a struggle over guardianship. And that's certainly something where we're very familiar in this community. And it was because of guardianship that a different player was able to approve of the lack of COVID-19 treatment for him and approve of then hospice care, which then also approved of not continuing feeding him. So all of that, to me, I saw was an issue of guardianship, that the family members were actively trying to get involved and weren't and didn't have a voice. And so I just wanted to throw it out to just go through each one of you and hear how has guardianship changed with COVID-19? Are there new concerns that both as policies and advocates and family members need to be concerned about? Doctor, would you begin?
So you're bringing up a terrifying issue, which is people with disabilities not having their lives respected, the integrity of their lives respected in hospital settings, and being premature withdrawal of life-saving care, even food, medications, treatments that other people would take for granted, being denied to people with disabilities because people falsely think that their lives are not high quality. So people with disabilities determine their own quality of life, and nobody should be determining somebody else's quality of life or making assumptions about it based on their disability. That is wrong. There is such a thing as too sick to live, but there is no such thing as too disabled to have good quality of life. And this is a very important issue for disability advocates. Some of the work that I've been involved in through Communication First, which is an advocacy organization for people who are non-speaking,
I'm going to interrupt you just for a second. I want to
can have advocates.
I'm going to interrupt you just for a
hospital.
second. I would like to mute all of our other participants just because I have some background noise. So I'm going to mute all and then unmute you.
Okay, that might be my child.
Oh, that's totally
noise
okay.
in the back,
No, I just want to make sure it's not anyone else. Okay, and can we hear you again, Doctor?
There you go.
Perfect. Thank you. Please continue.
Okay, I'm also the parent of an autistic 18-year-old daughter who is having a lot of vocalizations right now, and my wife is trying to take care of that, so I apologize if there's background noise.
No trouble.
But anyhow, we have new policy at the Department of Healthcare Services saying that having a supporter in the hospital for people who are non-speaking or people with disabilities is an accommodation that hospitals are required to provide, even during these difficult COVID times where we want to limit how many people are in the hospital at any time. But that is a right, and we have fought that battle successfully, and that is policy now. So that can help. Now, in terms of guardianship versus supported decision making, this can happen regardless of people's legal status, but people, regardless of their legal status, should be able to determine their own quality of life and weigh in on what treatments they accept and which treatments they don't accept. That's very, very important that we not make assumptions about people's quality of life, because people with disabilities rate their own quality of life similarly to that of the general population, regardless of their level of disability.
Absolutely, thank you. And you brought up a good point. Like this is legal protection we should already have too, even though we are having to fight it kind of again. I want to turn the question over to Shamika, and do you have, continuing just the conversation of guardianship and how that's now changed with COVID-19, do you have any advice too for advocates out there trying to get a handle of the situation?
Well, I know, with SANES, one of our big thing and our big focus is always making sure that people with disabilities know what their rights are and are able to get the supports that they need to make those decisions. And I know we've been doing a lot of projects around, a doctor mentioned, supportive decision making. How can we support, what are the, alternatives, to guardianship, and how can we support people, to the level that they are able to make their own decisions, and making sure that they do have a say, and they do know what their rights are, and they are able to speak up and get the supports that they need to make whatever decisions they need to be made about their lives. So I know that that's a very important focus for SANES, and helping people to know their rights and know what the options are and know what the alternatives are. So that's continues to be an important focus for us.
Yes, and before COVID-19, I definitely remember many advocacy organizations here in Arizona even that were doing like Know Your Rights trainings. And here, I think a lot of them might have stopped with COVID-19, not because we couldn't transition to Zoom, but lack of resources, focused on other priorities. And I'm glad you bring that up because it's such a priority now with COVID-19, and we have to remember that.
Definitely. I mean, even with us, I mean, that's always been our focus. It continues to be our focus. We were, with things going on here in New York and, people being hospitalized, we worked with, the state-run organizations to fight and to make sure, people that needed, someone in the hospital with them, we fought so people could have, that support in the hospital, even though when hospitals were locking down and saying, no, people need to have access. If somebody is, somebody's nonverbal and they need help communicating their needs, they need to have access to people, to someone that can be there for them and allow that. So that's still, like I said, we even made, even a bigger that was even bigger focus for us. Making sure people have access to technology. Because everything was, going online and, making sure, we're increasing people's access, and we're still continuing, to work on that to increase the access for people, because we know lots of people still don't have access to all of these online things, but we continue to advocate for that. And we did lots of trainings on, helping people learn this new technology, because it was new for all of us, but, especially, those of us who might, have disabilities, so we did lots of trainings and developed materials on how do you use this technology? How do you connect with people? What are ways that you can still, even though you might be in your homes right now, ways that you can still connect with others in the outside world. So those are all very, continue to be very important to SANES as we continue our work, online and virtually and things like that.
Thank you so much. Yeah, and that brings up that, my coworker, Melissa Ann Santora, she likes to refer to it as just physical distancing. It's not social distancing. We're wanting to be more social than ever. We just can't physically be together. So before I turn it over to Norm, I just want to make an audio change that I think is going to help our interpreters hear a little bit better. I haven't heard them mention anything, but there is a way I can make their sound a little louder. So 1 second. Okay, well, we're going to give that a chance to see if it helps them out or not. But I'm going to continue now to Norm's. Thank you for that. And I'm especially interested in your perspective, because I imagine, you are personally, working with individuals with both guardianship and those who don't. So you would see it on both sides. So let me make sure you are unmute this time. There you go. I would love to hear your perspective on how guardianship has changed and what we need to be aware of.
So, it's interesting because I heard Dr. Kripke mention that she has a daughter who has autism, is 18 years old. And we work with so many people here at COPA Health. Our foundation and our beginnings were with people that have developmental and intellectual disabilities, but we are also very active with the autism community. And, obviously the behavioral health, we deal with a lot of people that have serious mental illness. And, the interesting thing about my role at the organization is it's really kind of hard to explain because I'm just all over the place with the things I do. But I will say that I've gotten calls from 4 different family members since COVID-19, the pandemic has begun, and with everything that's going on. And, you know, one of them was a family member who has a child with a developmental disability. Another one was a person out in the community that I work with whose sister has behavioral health issues and they needed some help right away. And then others were family members of grown people with autism who were just struggling during this time. And the thing that I think that I feel very fortunate that I was there, because I know a lot of people in all of those communities, and I was able to connect them. It's not an answer to be able to say you needed to be connected with all of these resources ahead of time going into a situation, especially when you're talking about a guardianship situation. You have to know going in, but just because you're maybe ill prepared for dealing with it right now doesn't mean all things are lost. You need to reach out. You have to be comfortable reaching out. I know that I'm actually working quite a bit harder now than I was when I was going into the office every day. I happen to be in the office today, but I find myself never taking a break when I'm at home, because there's so many people that want to talk to me, and so many things that we're putting together, online events. We have a big emergency preparedness event coming up. But I believe that you have to constantly be aware of the people that are out in the community that can advocate for you. And if you're struggling right now, especially with a guardianship issue, you need to start reaching out to people and just asking the questions. The best thing that I've seen, other than maybe having a connection with the legal help that will really know this area, is to find other family members who have been through it. Family members who have already dealt with the guardianship issue. They might have come across some of these battles, and they're willing to, because people are just so happy to share their experiences. They are able to get you through systems here in Arizona, and I'm sure elsewhere, a lot quicker than just trying to start calling your local agencies or your state agencies. Reach out to other family members, find out what resources are available, and then going forward, stay part of them. It's not hard to continue to be part of these communities long after an emergency or a pandemic like this situation is shut down. Stay part of them, and make sure that people know that you're not just there to learn, but you're also there to deliver information to others who may not have the experience that you have.
Thank you. And for my next question, it's going to be the same for everyone. And, in our experience, I'm sure everyone has had a pet issue, something that's come up that they just can't believe is happening, now, something we're not dealing with, maybe it's lack of PPE, because I know, that a lot of people are aware of that. So I'm just going to express mine, and I would love to hear feedback on it, and then I want you to tell me yours. For me, something I'm concerned about is that we have some systems in place to give support for people who, are individuals who I want to say have more severe symptoms of developmental disabilities. I worry about the people who don't necessarily need support like that on a regular basis, but now with COVID-19 they might. Let me explain an example. I know lots of individuals that are youths with developmental disabilities and that work, and they are often like baggers at the groceries, and so they were considered essential workers. And I was really concerned that they weren't given education about the risks that they were then a part of. Not that they would necessarily had said no, but I didn't feel like they were even explained to have that opportunity. And so that was my pet peeve through this process. And so I kind of want to hear, if there's advice for that situation, what we can be doing as the advocates and organizations. And then I want to hear it from you, because I know you are a subject matter expert. So I'm going to turn it over, because the way my screen works, I see the doctor here first. Could you go ahead and let me know about your own pet peeve that's happening now with COVID-19, and what we could do for those who are working but have developmental disabilities? Oh, and I think,
I guess I have a What's that? I have a couple things. One is you were talking about guardianship and supported decision making, and I'm not sure that everyone knows what those terms mean and know that. So the disability community and the United Nations has moved away from guardianship, which is a process where a judge takes away someone's rights to make decisions in their own lives, and instead towards supported decision making, which acknowledges that some people may need support to make decisions, maybe a lot of support, but that they should be able to choose their trusted supporters to help them make good decisions for themselves instead of that right being taken away from them and given to a parent or a social worker or somebody who a judge offers to. So we have been very much moving towards supported decision making. My patient population is people who have very significant disabilities, many of whom don't speak and have no effective form of expressive communication, and yet we make it work quite well with in a supported decision-making process instead of conservatorships or guardianships where their rights are taken away from them. So I just wanted to add that in case people weren't totally following that conversation. In terms of pet peeves, COVID is going to go on for a long time. We are past the point where we can contain it entirely with quarantine and contact tracing. So there's a lot of virus in the country and in the world, and we're going to be living with this for the foreseeable future. And we need to adapt to that. So one of the things that I've been most concerned about is day programs and other types of congregate day services that and other. Oh, I'm sorry about that. Let me. I'll cut myself off. But congregate day service. Oh,
Can we just take a
let
second?
me
Go ahead,
stop
sorry.
that. I apologize.
We are all adapting. Oh. We are all adapting to this new world, so take a second. We're good.
Sorry about that. So if we take people who are living in different households, group homes, family homes, and we put them together for group activities, virus will spread and it will be bad. We learned about the financial health of service providers and people who provide day services, and I want good things to happen, and I know they have leases, and I am and I want to take care of them, but we cannot take care of them by putting people with disabilities in danger. And the sooner we realize that that model is not going to work for the foreseeable future, and start working on more individualized services in people's homes, virtual services, remote services, a lot more one-to-one, a lot more individualized services, the better off we'll be.
Thank you, and especially because that brings in day services. I want to turn it over to Norm because I want to hear both his opinion on that and us moving to more individualized services, and also your own kind of pet peeve of what we're missing in COVID-19. Oh, and this is my fault. Oh no, you're unmuted on my end. I can't hear you.
Sorry, I was on mute on my own. Sorry about that. I have a pet peeve, but I've been trying to be, generous in my spirit when I'm discussing it with people, because I believe that whatever situation comes across, you can turn it into a positive. And it's that we, as organizations, haven't taken seriously what can happen. We weren't looking before at what really could happen. And I'm going to give an example about that put my organization down, or any organizations that were involved. But we actually had a conference last year in August, planning for a pandemic. We had a specialist come in who talked about personal protective equipment. We had specialists come in that talked about how to disinfect and how to do all of this stuff. And even as an organization that hosted that put it together, we weren't as prepared as I thought we should have been. I don't think that we are unlike anybody else, but we just weren't. When we first heard about COVID-19, we thought, okay, we could pick up the phone and order more masks, more gowns, disinfectant, toilet paper. We really believed that we could do that. So we weren't as prepared, and I know a lot of the organizations that took part in that. But the thing about that is you can still take that and try to move forward. We're in a long period now where this has started to 4.5, 5 months ago. And so the conference that we're putting on this year has to do with resiliency in a pandemic. And I believe that along with not being prepared like we should have been, the other thing that I want to make sure that people realize is you don't have to live with the status quo. You don't have to take the first answer that you get from somebody as the only way that can move forward. For instance, we heard about the lack of masks that were available at the beginning of all this, and we thought, okay, how do we solve that problem? We called every vendor, and we just couldn't find masks. But we started realizing that there were ways for us to get the community involved, which are passionate about the people that we serve on all levels, whether it's intellectual, developmental disabilities. And we were able to share with them approved, templates so that they could make masks. And we just had an outpouring. In fact, it's still coming in. So I don't like when people take the first answer, that's the way it is. When they say that this individual who's been coming to one of our employment programs or one of our day programs, they're never going to wear a mask. I hate to hear that, because even though we know some of our individuals have behaviors, I've got behaviors. My wife goes to the store with me and she thinks I'm going to faint because I have trouble wearing a mask, but I still do it. And I believe that you can't just make assumptions about the capabilities of the people that we're serving, the capabilities of the staff that we have. You have to tell them, let's try what we can try and try to work forward to a solution. And that's especially true with our day programs. We've just got such wonderful people and they're so interactive, but I believe that they can realize what's going on and learn and adapt and be resilient in this situation too.
And then Shamika, I want to turn it over to you. Make sure you're unmuted here. There you go. And so, if you have response to the, our kind of pet peeves, I would love to hear from it, and then hear a little bit about yours over this COVID-19 experience.
Well, I think, all of those, I connect with all of the things that, people have said before. But I think, one of the, if I had to choose one, our kind of pet peeve, as a organization, or as something that we focused on, and that was like I said, making sure that people with disabilities weren't kind of left behind, because in a lot of cases they were, and that weren't, there were lots of things that people didn't think about, or there was lots of things like, places like nursing homes. You saw, that there was, lots of problems in those areas. So I think that would be a pet peeve for me, just in general, not even necessarily connected to COVID, is that, people with disabilities in a lot of cases are still kind of an afterthought. Especially if they're, in an institution, somewhere like a nursing home or something like that. So that would be a pet peeve, definitely for me.
And that just segues easily into what I was thinking about. And we had a webinar with NCLE, the National Council of Independent Living, on yesterday, and that was about alternative care sites. And so doing the research for that, I read lots of guidelines about setting up these alternative care sites. And for those who don't know, these are facilities that if the hospitals do reach what they call surge capacity, and that's they just don't have enough beds in that facility, they can use another facility to provide beds and resources so they can continue to providing treatment for people, but it's outside of their traditional hospital or facility. That obviously causes lots of accessibility problems because we're now using facilities that we haven't already approved with like ADA coordinators, and we now need to do this on a very big rush. It kind of reminded me of voting polls a bit, but even more rushed now with COVID-19. So what brings me to specifically developmental disabilities is that when I was reading that, it had a specific language that said that this was not responsible for accessibility, that you needed to look at your local jurisdiction's plan for accessibility requirements, and then it would list a couple of things for individuals who are blind, individuals who are deaf, and individuals with mobility impairments. And that was it. And so there's obviously lots more on that list, and you can notice developmental disabilities is left off. And so I was concerned that local jurisdictions do not have already guidance for how to address the developmental disabilities population in their pandemic plan. And so I guess I want to hear your thoughts is if you think the local jurisdictions have this ready, and if they don't, how can we as organizations and advocates, educate them on what they should be included. So just to turn it around now, I'm going to start with Norm this time and move that way.
So let me make sure I'm understanding the question, Sarah. Could you just rephrase that?
Oh yeah. And really, it's just based on my own experience. The pandemic planning for these are alternative care sites. So these are just they're kind of not hospitals, but pseudo hospitals that are going to be a result of the COVID-19 surge. And they didn't have, in what I could see, any of the guidelines from the federal government, from various task force and agencies, anything that addressed developmental disability populations. It only said that you needed to look to your local jurisdictions to find those accessibility requirements or recommendations. And so I guess I'm wondering if you thought local jurisdictions, like every county and city, had developmental disabilities in their pandemic planning, which is kind of something I doubted, but I would love to hear your opinion. And if they don't, what can we do to protect this population in the pandemic plans? So it's kind of a long one, but there's no one better to ask than you three. So I would love to hear it. Anything you have?
Yeah, the reason that I was a little bit hesitant at first is because I was a part of a group a few years back that was focusing on emergency preparedness for day programs, specifically for people with intellectual and developmental disabilities, and the ability to pull together other organizations in an emergency. And I want to make sure that we understand an emergency could be a very personal thing. It could happen to one of us. I could be in a car accident, or I could come down with cancer, and that's an emergency. Or it could happen to an organization or a location at an organization. And one of the things that we were trying to do is get memorandums of understanding amongst all of us in order to make it clear that if we had a chemical spill that shut down one of our sites, we would be able to make arrangements to move the individuals that we work with to another site of somebody that was part of the memorandum of understanding, the agreement. And we found it very, very cumbersome to try to cut through the red tape that exists in the state. I don't ever want to say that the state created, because I don't think people intentionally create the hurdles for us to get over. But one of the things that we were struggling with was in an emergency, such as a pandemic like this, how do the dollars work? Do they follow the organization? And if the organization is all of a sudden in a different part of the county or a different part of the city, are we still able to, bill for the services that we have? Because a pandemic such as we have now, I believe that there's going to be a lot of organizations that are going to go out of business because of it. They're just not going to be able to bill. They're not going to be able to do the things they need to do. And if we had a better synergy amongst all the organizations that was approved by, the way the state set it up, I think it would be much better. But that being said, I know that the Department of Health Services in Arizona has really encouraged us to try to work to tell them what we need and to change the laws, standard operating procedures around things like that. And they've worked with us to try to promote things like the emergency preparedness conferences that we put on, to try to make sure that we're working with each other on a statewide level. And I've been part of that effort too. It's a behemoth, because it's sort of like when everybody was trying to deal with the Y2K problem. There are so many differing systems out there that there was no one-size-fits-all answer. So I've spent time talking to organizations where they are a single-day services program that serves 10 people in a nice small building on North Phoenix, and then we've got organizations like ours that have 200 people in 3 different sites within a couple square miles here. So the difference has just been a little bit too great to overcome. So even though we don't have the process in place to make sure that these smaller organizations necessarily will survive, I do think the state has tried to come up with solutions, especially in emergencies, specifically with developmental, intellectual disabilities and physical disabilities. I know that we've done lots of things with them to try to move the standard forward in Arizona. It's just a huge task to solve, and over time our group kind of just dwindled, and to the point where it wasn't working. So now we're coming at it from a different point of view. We're trying to have more of these actions where we estimate that certain groups can do certain things if they have to have somebody else come in, and that includes being able to bill if you're at another location, to be able to withstand some of these disasters that happen, and frankly, to be able to be more of a friend with each other, because right now people are grabbing for the dollars. Actually, let me take that back. Prior to COVID-19, people were really struggling to get the dollars out of the system, and I think that that's great. Everybody should be able to stay solvent, but we weren't thinking so much about the folks who are at smaller organizations not being able to survive this pandemic.
Yeah, and thank you. That brings up a great point. I can say even our organization, we're the Statewide Independent Living Council, so we are federally mandated. We're a government council, and we still have to just balance our interests and priorities for our own budget and like the solvency of that small organization with our Centers for Independent Living, which are much larger and should be, because they're providing the direct services to the actual consumers. And so, it's strange. We all have to get in a group together as totally separate organizations and, have a budget that represents all of us. And it sounds like that's kind of what we need to accomplish in these other areas too.
Yeah, and the thing that's interesting, and I don't want to take up too much time here because I know we have other people that are going to talk on the subject, but I actually know individuals that I've been very close to over the years. Right now I'm in the development, I run our foundation and I do fundraising and grants and things like that. But I actually know individuals that we serve out in our day programs and some of our group homes who, over the years, they've moved on to other organizations. I know that there are other organizations now, and I think about them, and I hope that they're getting the great services that they deserve, but also that those organizations are able to survive, because it's going to be very difficult for them to find services in the future should their current caretakers go away for some reason.
Absolutely. And then I'm going to turn it over to Shamika. And I just kind of wanted to hear a bit about your considerations on the topic. It's hard to kind of keep track because we deviate and bring up a couple of issues too. So backing up to the original question, we had the webinar on alternative care sites, and I just didn't feel that the guidelines provided any consideration for developmental disabilities. Is there a way that we can change that, or do you believe that the local governments individually have recommendations and accommodations provided for this community?
I think even before COVID, emergency preparedness and people with developmental or any kind of disability was not a topic that enough people were talking about at the local level, at county level, at any level. And I guess that would my answer would kind of go back to the pet peeves thing, as and I've said this in other conversations. When we're going in school, and there was a fire drill or some sort of emergency, that their emergency plan was, you go into a room, you wait there, and we'll come and get you. And that's everybody's plan. Just wait in this room, and then we'll come and get you. And it's like, that's not a plan. That's not okay. And that seems to be everybody's go-to, and it's not a conversation. And so it's definitely needs to be more of a conversation at every level. Because no county, no anybody that, at least here in New York, I am from New York. So, but it's probably this has any real plan and any real anything that is sufficient in my book.
Absolutely, thank you. There was a documentary to give them a shout out called "The Right to Be Rescued" by Rooted in Rights. And that wasn't specific to developmental disabilities, but it includes all of us, and it was so critical in showing that the real situation of what happens when people do get left behind in these plans. And you can do so much as an individual, but you really need I would say really need government support. Ooh, I'm going to mute myself and turn that over to Dr. Clarice because my dogs are barking.
I'm glad I'm not the only one. That makes me feel better. Can you hear me?
Mm-hmm.
Okay, great. Yes, government, we all need to prepare for self-sufficiency, because government is not going to be able to solve these large problems. We've had several disasters lately in California where I am. We've had fires where people with very complex disabilities needed to be evacuated very quickly, and we have had COVID cases in our homes where we needed to respond quickly to prevent the spread and to help people. And I agree with you that our government systems were not prepared, that they had not thought about it, and they weren't helpful. They tried very hard to be, and most of them came through with solutions about 3 days to 3 weeks after it would have been helpful, but they're just not able to respond quickly enough. So as we were making preparations in March and saying, look, number one, we have to prevent this disease, because the options for treating it and the options for containing it are not good for our community. And so we really need to do what we need to do to prevent it. And to Norm's point about not leaving people, and Shamika's points about not leaving people behind, we need to figure out how to be very, very cautious about not spreading this disease in our community, and give people a good quality of life. And that's a significant challenge. So I think that some of the things that I've been working on, at the beginning of the pandemic, before we most hospitals, fragile people, but I said keep people home, even people who are very sick, and we'll hang an IV, we'll send a nurse, we'll do a lot more home care, we'll do a lot more individualized services, and we'll do it ourselves, and not rely on those other systems that really aren't prepared to keep us safe. So that's coming up with local solutions, being prepared for self-sufficiency, helping each other through these disasters. When we had the fires, again, government was no help, and the residential service providers just said, we're putting them in a van and we're going to their day program site, and we're going to camp out at their day program site for 2 weeks until it's safe to go back. And we told the people who were supposed to be making decisions and having plans what we were doing, and again, 3 weeks later they said, oh yes, that was an okay thing to do, having provided no actual help in the moment. So is that ideal? No. Is that the way it should be? No. But I think that's the reality, and I think we need to embrace that reality and make sure that people think ahead, that people have the support to think ahead. The one thing that has been very useful from government sources, the Department of Public Health and the Developmental Service System, has been getting access to personal protective equipment, which we could not do as individuals. But we're, to a large extent, we're on our own, and knowing that is important ahead of time if people are expecting government to do something effective. It's just not going to be able to.
Absolutely. Just write my eye real quick. Okay, there we go. I was going to distract me the whole time. We had a conversation on Tuesday, and that was related on another webinar, and that was related to the nursing homes and assisted living facilities. And the conversation was about giving them liability protection, legal protection from individuals that might be harmed during COVID-19. And one of our guests brought up a point from their perspective. He was an association that owned nursing homes, and it was that, as this is a global pandemic, there wasn't reasonable for them to have stockpiled the amount of equipment needed for this, or to have anywise not needed government assistance in order to effectively stop the spread. And so I really want to hear that from Norm, because it might not be nursing homes, but you're dealing with that same situation. Did you have, you mentioned already, it was hard to get supplies. Where did you feel like the state should have been providing that? Can they provide that now?
Yeah. Can they provide that now? The short answer is I don't know. I will tell you this, that after the initial punch to the gut that we all took, the state has stepped up and they've provided us with, a lot of stuff. But right at the beginning, we, like so many other organizations, we were on our own. Our normal avenues of getting PPE was just not available. Our normal avenues of getting, some of the stuff that would help us out as far as, cleanliness, and disinfectant, toilet paper. Every time I say that, I'm so amazed that became such a difficult point. So all of our normal routes had just disappeared. And, when we turned to the state, they were, I don't want to say holding their hands up, they were throwing their hands up. They were trying their best to get us what we needed, but it just wasn't there. And I believe that from the federal government, they were expecting certain things. And I try to be very politically correct, Dr. Kripke, in that I don't necessarily look at the individuals that are running our government federally, state-wise, county-wise, or locally. I don't hold them to the responsibility for everything, but it was just such like I said, a punch to the gut to the entire system that no, it was not there, it was not available. Now, we really started to, looking around and trying to figure out things that would work, substitutes, cleansers that met the needs, but they weren't necessarily what we normally would buy for our group homes, for our day programs, for, all of our sites. We started to look around to see, if we had friends in the community that would be able to provide, gowns or masks or even the shields. And we started to, to see what else we could do as far as accelerating telehealth programs and things like that. But the idea that your government is going to be able to take care of you completely, I think was really shattered during this event. And I don't, as being as independent as I possibly can be, I don't think it was necessarily a Democratic problem, a Republican problem, a conservative, a liberal. I think nobody saw this coming. I'm doing a lot of research right now on the pandemic of 1918, the Spanish flu, and I'm finding out that so many of the things that happened then are also happening now. And I ask myself on a regular basis, should our government have a 100-year-old memory? Should we, be as prepared as we should be when dollars can be spent in other places? And my answer is, I don't know. But you cannot have that answer for individuals who have, as a child with severe intellectual and developmental disabilities, possibly physical disabilities. That's not the answer they want to hear. So we learned to become more independent, innovative. We were pivoting in so many situations. We had individuals that weren't able to man our group homes, for instance. We had staff that weren't able to get out to our group homes because they had concerns and they were having to be at home. So we were able to take folks at our day programs for the first couple of weeks that were shut down and move them over there. But I don't believe the government necessarily was more ill-prepared than the rest of us. But nobody saw this coming. I don't think the plan that they had in place could have predicted that we would have a once-in-a-100-year pandemic. And I'm not trying to give anybody a pass on that. It just means that we need to do better and we need to be more prepared in the future. And I think that's especially true as far as the capabilities of rolling out testing and things that we're finding right now. I see good people on all sides of the political realm trying to do, great things to make this better, but we should be more prepared to work as a unified country. And I think Dr. Kripke brought that up earlier. We just don't have that unified message right now in the United States.
Thank you. Something that you brought up just a moment ago that I want to lead in with Shamika is about the individual preparedness side. Especially with the experience you were talking about with doing Know Your Rights trainings. I would like to know, now with COVID-19, how do we train this community, to wear masks, if they can't, what other precautions they can use, what can we as individuals be working on as training, but that trickles up, right? So then what can I be then trying to encourage for organizations?
Well, I know SANES as an organization, what we did as part of our weekly Zooms that we do is we did some of these trainings. We worked with organizations like the Red Cross and on helping people know how to make individualized emergency kits. What do you do for yourself in an emergency? How do you build an emergency kit? What are some items that you might want to have in an emergency kit? We also did trainings on social distancing, helping people understand what, people with developmental disabilities, what does that mean? What does that look like? How do you explain that to somebody, that may have a disability? As far as wearing masks, we had trainings from, parent organizations on how you help somebody that might, be sensitive to wearing a mask, or have different sensitivities. So we've, these are some of the things that we've done, and helping people, get those resources, as individuals, people with disabilities, having those trainings, having those, those resources and information. This is what, when like our government started talking about phases, the different phases, we had, trainings on, okay, this is what this phase means, and each phase. So we would talk to, people, and, another thing that we've been doing, as an organization, when our state wide, organization, Developmental Disabilities Organization, would put out different guidance for different, restrictions about day programs and different things like that. We would make like easy read versions for people with disabilities and say, okay, this is what this means. This is what's happening. This is why you can't, go to day program, or this is why, when you come back, why your day program might look a little different, or maybe you'll be in a different place, or maybe you'll, have more programs at home, or, so explaining to them all of these different things that were going on, so they can understand on their level, because there was always information about, for parents, or information for providers, and information for, all these other different organizations and groups, but not necessarily people with disabilities themselves. So we always made sure that we were working with these different organizations to provide information to the people with disabilities themselves, and letting them and connecting them with these organizations so their voices are heard as well. Like I said, on our weekly calls, we have, these weekly calls. We had somebody from the parent organization. We had somebody from Red Cross. We had somebody from the, the different state-run organizations, so they can hear from people with disabilities themselves, and they could get the information on their level. So that's something that we've been doing as an organization.
I love that. That's something I think we need to be implementing at AZ Silk, because we have a good relationship with our public health department, but we don't have, quite like a structure like that. And providing structure seems very helpful. Okay, and I want to turn over the question to the doctor here, Dr. Kripke. The same thing with training, I do lots of individual preparedness trainings, but I can't say that I've done one that was specific to this population. It was just all in general, disabilities, which included a few, but my content wasn't ever specific. Do you have any recommendations or things that we could be doing that helps communicate with this population?
Yes, so I think that the work that Shanika is doing to speak directly to people with disabilities is critically important, and the best people to talk to people with disabilities are people with disabilities. So we should be including people with disabilities in everything we do, because that's who understands what the issues are, how to communicate best, and how to reach people in the most effective way. I also think that circles of support are critically important in helping people to build their circles of support. What Norm was saying about, could we have predicted exactly what was going to happen, and could we be prepared for every eventuality? And yes, we could have done a whole lot better. We've done a whole lot better in the past, but no, we can't always prepare for everything. And the things that make people resilient are having those circles of support, having people you can call, having people looking out for you, having people checking in on you. I've reached out to so many families who say, I'm a mother taking care of a person with a complex disability who can't be alone for a minute, and there's no one else in our lives. And I said, there's nothing more important than fixing that problem. You need someone calling you every day to do a check, and if you don't respond, they need to be showing up at your door. You can be doing that for another family in the same situation. So when I said you need someone to check on you, I'm saying, who are you checking on as well? That we need to do this for each other. And that we need to be there for each other because these government systems are not going to be able to solve the whole problem, and they're going to be slower than we need them to be. The other thing that we need is to make sure that people are in safe housing. So a lot of the problems have been in institutional settings. A lot of the problems have been in overcrowded group homes where people don't have private bedrooms, and so they can't that are understaffed and under-resourced, so that they can't limit how many people one service provider serves, who goes from client to client or home to home and spreads virus during that time. These people need to have enough extra staff, so that if a staff is out, like the kinds of problems that Norm was describing, that when they didn't have, if a few staff were out, they couldn't staff their homes, and that was a problem. So some of this is making sure that people have the basics in life: safe, stable housing, a circle of support around them, people who care about them, relationships with them, access to food, access to the emergency supplies that you mentioned, Shamika. These are the basics, and I think one of the original questions was, what's changed for you? And I was making a list for that, and I was saying, well, there's some things that have changed, but a lot of the things that we need are the things that we've always needed, and this is just bringing out the importance the importance of those things that we needed. So things like individualized services, home and community-based settings that are where people have choice and control over their lives, where people have their own bedrooms. We need deinstitutionalization. We need people to not be living in institutional settings in the first place. They're not safe. They never have been safe. COVID has made that very apparent, but they weren't safe before COVID. We need emergency response. We need to pay attention to abuse and neglect, which is always an issue when people don't have relationships outside of their homes and they don't have control over their lives. So I think that crises are opportunities, and we have long-term policy as a disability advocacy community goals in these areas, and we shouldn't waste this opportunity to say, look, this is now you understand why we need this and why we need it now. Get it done, and maybe we can get some things done that we need to get done for a long time.
Thank you. And I wanted to turn it to Norm. Even though I've had the opportunity to tour one of the facilities at Copa Health, but my example is going to be from England, just because I had a chance to spend a whole week at one facility there, and it's called Pennyhooks Farm, and it was for people specifically with autism, and it is a place where it's just meant to have people do real substantial work. They're working on a farm, making a difference. They're selling eggs, they're crafting, they're learning skills, and it was just great to see how fulfilled that these individuals were every single day. And they were still independent. They went home, but they came here just every day, at least 5 days a week, and it was just such an important part of their lives. And to imagine that was cut off with COVID-19, is just tragic. And so, I recognize the important role that Norm is doing. And so I just want to hear from you, how do you keep your facilities open for as long as you can, because that the individuals there want them?
Well, it's actually been very exciting, and I'm going to be careful so that people don't think I'm taking any of the credit, but we have a vice president in charge of our employment-related services program that has been with us for 35 years. And she doesn't even look 35, but she is so innovative. And she has been able to help us get partnerships with the Chicago Cubs, the Colorado Rockies, Arizona Diamondbacks. We have a group out at Boeing that are doing work. But she's also come up with some really great programs that allow people to work in more of an isolated area, or as things get better, as the group on things. We've got, for instance, she started a company out of our employment-related services program called Copa Cookies, and it's baking and it's putting cookies out there, and it's just so cool. And it goes along with the fact that we have other programs that sort of match that. We not on our intellectual and developmentally side of the house, but on our behavioral health side, we run a restaurant out at one of the retirement communities here, and that gave us a lot of ability to start pivoting and start teaching people. And they get the food processor card, food handler's card, and we set up the ability for people to in some of our actual locations with commercial ovens, and that's going really well. We have another group that has partnered with us for a long time called Me for Kids. And Me for Kids is a for-profit organization that produces medical supply kits that are focused on children. They've got cool little things like Band-Aids with superhero pictures on there, and they've got like 30 different products that we actually package for them. And with that, as long as we've got the social distancing and we put up some of the plexiglass barriers, we've still got probably 60% of the people that were working on those programs still out working on them, and we're able to keep them safe. But we at COPA really, pride ourselves on innovation. It's one of our 6 core values. People first is our first one, and that comes with all that implies. But innovation is out there also, and so we are taking suggestions from anyone. We've got people that want to start running a petting zoo. We've got folks that will come in and do Zumba in some of our day programs, and we're still able to do some of that because when we're doing Zumba, it's actually easier to keep them socially distant because we tell them this is your area, and we just keep driving home the point that this is a problem, but the hurdle isn't so big that we can't still provide services with for as many of the people as possible. And the percentage that we have in employment-related services is at 60%. The percentage that we have in our day programs, so we have 5 fairly large day programs, is 45 to 55% every day. And obviously, it goes without saying that the percentages in our group homes have remained at 100%. But keeping them engaged, we got a grant through Walmart to put out additional activities in each of the group homes so that the individuals that we serve have just more to do. And I didn't get the joy of doing it. I tell people my one small contribution to that is handing over my company credit card so that the people that work with me were able to do it. But it really allowed folks to start having still a lot of interaction without the idea that, hey, this is an isolated incident. Now, I will say this, on our behavioral health side, I know we're talking about developmental and intellectual disabilities, but on our autism and our behavioral health side, where people are more independent, we are struggling just like everyone else, but we've come up with some fantastic ways to keep those folks engaged. We've got, new telehealth programs, new online. We actually have a lot of the people that we serve on Zoom meetings, interacting with people. So we're doing our best on that, but it's actually, a little bit harder because they are independent and a lot of them live on their own, and they have to stay away from our employment services. They have to stay away from our day programs, and the services they get through our clinics was difficult at first, but now it's really, trending up on the telehealth side. So, but I'm just always so proud every time I print out one of those Copa cookie labels for them to put on the cookies when they're selling them to people, and we've donated them. We've donated so many of them to hospitals and first responders during the COVID-19 virus. And the thing about that is, obviously, we normally don't give them away for free, but because we're still providing services and we're able to bill for the services, we are able to donate a lot of those cookies to some of these great hospitals and first responding organizations, and it just tells them, hey, that they're not alone. And the people that we serve, even those folks that might have a severe intellectual or developmental disability, they understand that they are giving to others, and that makes them feel so great about themselves. And talk about a way to keep a person's spirits lifted, than to allow them to give to others.
Thank you. And when there's a petting zoo, I'm coming. I'm going to spend a week there when there's a petting zoo. Shamika, I want to turn it to you. Let me make sure you're unmuted. Definitely feel free to address anything we've talked about, but one thing I want to hit on before our last question is that there's so much I've learned through COVID-19 about Medicare and Medicaid payment structures. And with the nursing homes, it was very critical. So I just wonder, have you encountered any barriers caused by, an institutional structure like Medicare and Medicaid not providing the services your clients need?
Well, since Sanings doesn't actually provide a direct service that would be paid for Medicaid and Medicare, that's not necessarily a problem for us, but the individuals, including myself as a person with a disability, there are, barriers with Medicaid and Medicare of people getting the things and services they need. Even before COVID, it's not necessarily a COVID issue. And we could probably have a whole nother webinar all day on the issues with Medicaid and Medicare. It just continues to be an issue of making sure that, people that are eligible for Medicaid and Medicare actually have those services, and then actually, are provided with the things that they need in a timely manner, which has always, like I said, been a barrier. It was a barrier prior to COVID, and continues to be a barrier, and again, understanding the differences between Medicare, what Medicare does and what Medicaid does, and then you have those people that are eligible for both, which is a whole nother barrier in itself. So yes, that continues again with the advocacy and knowing and understanding and helping people understand what they are eligible for, how they keep their benefits, and one of the previous speaker was talking about working, and that's for a lot of people, benefits, people don't want to pursue work because they're afraid, I'm going to lose my benefits, because they don't fully understand, they don't have somebody that helps them fully understand exactly what that all entails, and that there are different programs out there that allow you to work, have some income, and also keep your benefits as well. And even if you get to the point where you're getting less of that benefit, hopefully you're getting more income, so it balances itself out, and helping people understand that and not creating fear in them, because it's been my experience that a lot of times we have people that are creating fear in people with disabilities to not do new things, not try new things, because oh, well, you don't want to pursue that because you'll lose your benefits. Or you don't want to pursue that because it's going to be hard. Or there's going to be something. Instead of helping people figure out how they can work through the barriers. Mm-hmm. You know, tell them right off the bat, well, that's going to be a barrier, so we're not going to even pursue that. But, you know, and that's, again, back to the pet peeves conversation, a pet peeve for me as an individual, you know, where I hear people say that, well, that's going to be really hard. Well, how about you help me get through the hard parts instead of saying, that's going to be hard. What are the barriers? How can we work through those barriers and help people, you know, like some of the other speakers said, helping people get self-sufficient. You know, how can we help you be as independent and self-sufficient as possible?
Thank you. Next, I am going to ask Dr. Kripke and Norm the same question, but just to get you guys thinking, after that, to be on time, will just be our last question, which is, considering our audience. You know, our audience is the disability advocates and the emergency managers. You know, what message do you want to leave them with? You know, any action items, anything you want them to have on their radar to pay attention to. So I just wanted to refresh everyone. That's going to be our last question. And I do want to respond to Shamika because I'm a benefit of the Ticket to Work program, and I was on Social Security disability when I have Addison's disease and neuropathy, so my condition was very severe before treatment, and then I was able to get treatment, and I was very afraid of returning to the workforce, and it was my Center for Independent Living that guided me through that whole process. So a big shout out to advocates like you that help people get over that fear, because I had been very afraid. Dr. Kripke, want to make sure you're on mute. Okay, turning it over to you, you know, I'm sure you've had a lot of experience with CMS, with the Centers for Medicaid and Medicare Services. You know, how have they been barriers or helpful during this COVID-19 situation?
Well, I think that as a physician, that right now the federal government is printing money, and my contracts for the clinical care I provide have been renewed. I think health plans, Medicaid and dual diagnosis health plans are doing fine financially because they haven't been paying for routine care, so they're actually full of a lot of money. But so I have not had, and they've been very generous toward service providers who might go out of business so far. However, so far, financially, CMS has been fine, but I think the real problems are yet to come. We can't print money forever. There'll either be inflation or we're going to have cutbacks. States have to balance their budgets, and when they do, it's going to be quite painful. And no doubt the disability community is going to be hurt since they use so many different lines of government support. When they start taking cuts, then our community gets hurt in many different ways. So one thing we can be doing while we're all home board is registering to vote and helping people to figure out how to vote by mail, and educating our constituents about what the issues are. And Norm, I appreciate you're not trying to be partisan or political, but there's no doubt that there are some people being constructive for our community and being constructive for this pandemic, and some people who are being the opposite, and they need to be voted out of office, and the people who are useful need to be voted into office. That is critically important that we participate in that system, and that we educate ourselves about what government can and should be doing, and how resources are allocated, and make sure that we are very loud about what needs to be done in the next stimulus. Some things that stand out to me is that adults with disabilities who are dependents didn't get any stimulus money, and families who are supporting an adult family member with a disability are certainly struggling financially a lot, and that would have been very helpful, and I don't think that was the right decision. And I think that home and community-based services, increasing home and community-based services funding, so that people can get the services that they need in their homes and communities, was also not part of the stimulus bill. So our community needs to be smart, it needs to be focused, it needs to be organized, and it needs to vote.
Thank you. And I'm going to turn it over to Norm with the same question. Is there ways that CMS could be more supportive in this situation? And feel free to include comments on, not being, we all have to be, all four of us have to be really careful about what we say politically. But is there anything that we can do, just encouraging the right to vote and participate? Please feel free to share.
Yeah, I agree with Dr. Kripke 100%. But I work with people on a daily basis, and I always try to convince them, whether they are left, center, or right, that the smart thing to do is to fund these programs properly. I believe that if you give me any kind of emotional argument, I can substantiate it with a fiscal argument too. And behind most fiscal arguments, there's a very emotional argument. I tell people that all the time. And I just know that a small group of people, and we've always heard this, can always make a difference. I know that I worked with a group a while back. Actually, I continue to work with them on the behavioral health side called ACME, a group of family members who really were able to make a difference in their field. So we are always working with groups and trying to pull them together. And they need to not just get out there and vote in the right people, the people that are going to support these types of efforts, but they need to constantly be putting pressure on their local, county, state, and national representatives. They are the people that weren't prepared for the COVID-19 virus. We all weren't, but they obviously weren't either. They are the people that weren't prepared for the Black Lives Matter movement. They are the people that don't see things that are coming out of left field because they're too busy focused on what they think their constituency wants. And what happens then is something happens in our world that changes quickly what their constituencies want, and they weren't ahead of the game understanding what that could be. I believe that there's so much change right now that is afoot nationally, internationally, that now is the time that we can really make a difference. Yes, get the right people in office. Dr. Kripke, I agree with you completely about that. But we can't get so emotional during these arguments right now that we don't see that we have a chance to really move everything in the right direction during what is basically dual crises right now, actually three crises at once, a pandemic, an economic crisis, and obviously the racial unrest that we've had in this country, which should have been dealt with decades and decades ago.
Absolutely. And with CMS, is there any way that Medicare and Medicaid could be more supportive of any of developmental disabilities or anyone working in that field?
Yeah, they need to be flexible in the guidelines that they have for spending dollars. They need to be flexible, realizing that a rate that we might have for a group home for an individual isn't going to cut it when an organization like ours and many other organizations, we're getting a different rate for day services, a different rate for employment-related services. They have to be flexible in their ability to allow not just those dollars to go out as to improve the situation, but allow organizations to earn those dollars. Just because all of the folks that we have that are in the group homes, many of them have to stay in the group homes because of sheltering in place and the concern, because so many of our people have co-occurring conditions that we still have to be able to bill properly for the other services that they might have been getting otherwise.
Thank you. Yeah, even the Arizona Statewide Independent Living Council gets to work with Diverse Ability Incorporated, and this is to produce youth leadership forums. So they occur every summer, and they're about a week long, and they always have been in person. And suddenly we had to move it to a virtual world. And I remember a few nervous days where we weren't sure if we were going to get funding and reimbursement for things we've already paid for due to that virtual move, and it was a little scary.
Yeah.
So flexibility is really needed. So for the last question, I'm going to keep this order here. I'm going to turn to Shamika. Any words you want to leave this audience with of things that we could be doing for developmental disabilities during COVID-19?
I would just say, one of the things that's keeps coming up is voting, helping people, and that's another topic that we've been doing a lot around, is helping people understand why it's important to vote, how to vote, how we get support to vote, and understanding, how that's connected to all of the things that we find important, like these services and things like that. So that is just really, and with this, pandemic, one of the things that, came about was, mail-in voting. But, I don't know about your states, but that didn't exactly work as planned here in New York State. And it left a lot of people with disabilities, even though that was the main group it was really supposed to help, without the ability to vote. Lots of people, didn't get their absentee ballot, didn't understand, the application. So there was just a lot of things with that that were barriers and that were issues. So I just say, to wrap things up, is just keep advocating, supporting individuals. If you're an advocate, if you're a parent, helping people understand their rights, understand the resources, reach out to, organizations in your area, that support families, support individuals. If you're in New York, you can reach out to us and me as an individual advocate. Even people, that are not in New York reach out to me, sometimes too, which is fine as well. Because everybody's online, so you're connecting with people, all over the world these days, right? So, just knowing what resources are available to you, knowing how to advocate, and knowing what your rights are. And so that's what I would say.
Thank you. And the same question for Dr. Kripke. There we go. What kind of words of advice or issues do you want to have on the radar for us as disability advocates, emergency managers, and people, individuals with developmental disabilities, but their friends and family?
Well, I'd like to say it's not all bad, that this has brought awareness about the issues our community needs. Some of the telehealth can be a great boon to our community who has access issues with getting to doctors and getting to services. So opening up the virtual world to people with disabilities, addressing the digital divide in education, in our family, having religious services and school and social organizations can be opportunities for better inclusion than we had in person online. So if we make sure that people with disabilities have access to the virtual world, people can go places and experience things they've never experienced before, and their lives can be broadened rather than narrowed. And there's a lot of very interesting people who are bored but willing to do Zoom that you might have been hard to meet in person. So there's been a lot of good things that have come out of this that we can build on. Access to doctors, access to education, access to activities, access to inclusion. We need to make sure, like Samika said, that people aren't left behind, that when people are creating new services for the COVID lifestyle, that we're making them accessible to people with disabilities. But there's a lot of opportunity for creativity and for connection. Although it's kept us physically apart, it's increased people's need for social interaction in a way that can be very helpful for people with disabilities, because we want to be included and we want to be social too. So I think there's a lot that we can do for emergency services. For emergency services folks, we should be thinking about more individualized services and being able to provide services to people in their homes and services to people virtually, as well as in these alternative sites and whatnot. But some of the solution is providing services in people's homes, going to them instead of expecting people with disabilities to go to inaccessible places. That can be an area of innovation too. So, thank you.
That's great, and I like that broad perspective change too, especially with like the alternative care sites. You know, how can we provide more of that care in people's homes? Norm, I want to turn it over to you. Any last thoughts you want to leave with us about dealing with the COVID-19 situation?
You know, the last thought that I would have is, first of all, I'm afraid are a long way from being through this. So there's so many more months that we're going to have to deal with it, and it's a good time for us to make those pivots and make those changes. I heard about the digital divide. Of course, I think that we can all improve our technology capability for the people that we serve. I mean, we've got touch screens on the wall for the people that we serve in our day program, but every single one of them could use an iPad for the most part at home, and working towards getting that. And make sure that what you're implementing, what everybody is implementing right now, is something they can carry through far beyond the COVID-19 crisis. The things that we're putting in place are, going to become best practices for us going forward in the future. And whether it's just your average everyday or a small emergent situation or a big emergency, we're going to have those there still for the future, especially in the areas of teleconnectivity, internet capabilities, telehealth, and the way to pivot and do things like that. But yeah, just some of the greatest inventions in the world have come out of necessity, and let's just make sure that while we're putting them together, that we realize that these can be with us for a long time to come, and to really embrace them.
Thank you. And I love that even despite the challenges right now, we get to leave on a positive note. So thank you guys. And I want to take time to thank our panelists for their flexibility today. They all got information for the Zoom event like an hour ago, so before the event started. So they were all awesome at being flexible with us today. And I do want to shout out to my fellow moderator who couldn't join us today, and that's Dawn Bailey. She just had a family situation she had to take care of, and our thoughts are with her. So thank you three so much, and I look forward to talking to you via email.
Don't get too ahead of yourself, because they shut down on
And thank you guys so much. I'm so sorry you had to interrupt me about the mute situation, but you got that worked out. You're awesome as usual. You were all done, so you have a great day.
Thanks, you too.